everyone. Welcome to today's webinar. I'm Shelby Kinnaird, National Program Lead at Diabetes Sisters, and we are thrilled to have you join us today for this important and informative session on diabetes and hearing loss. Whether you are someone living with diabetes, a caregiver, or a healthcare professional, this webinar is designed to provide you with valuable insights. Before we dive in, just a few housekeeping notes. This session will be recorded and made available for replay on our website. You can submit your questions anytime during the session using the Q&A feature. We'll address as many of your questions as possible after the presentation is over. Now, it's my pleasure to introduce today's speaker, Joanne Rinker. Joanne is a registered dietitian and board-certified advanced diabetes manager, currently serving as the Associate Director of Medical Education at Mankind. Today, Joanne will be sharing her expertise about the connection between diabetes, depression, and hearing loss. Please join me in welcoming Joanne.
Thank you, Shelby. So I want to start just by telling you guys a story, because I know we have our audience is a nice mixed group of people with diabetes, as well as people who care for people with diabetes, and healthcare providers. So I just want to start by telling you in 2012, which seems like so long ago, 12 years ago, I was at a conference, and I happened to sit down on a bus to a 5K with an audiologist. And the first thing she said to me was, after she introduced herself, was, do you know that there's a correlation, a very direct connection between diabetes and hearing loss? And I said, no. And I was I was kind of coordinating a statewide diabetes self-management education and support program in North Carolina. And I thought, if there's this connection, surely I need to share it with all of the nurses, dietitians, pharmacists, providers who I was working with across our state in North Carolina. And so after that, we ended up doing a lot of work together. Her name is Kathy Dowd. She's an audiologist in Charlotte, North Carolina, and led what's called the Audiology Project. But it's because of her and what I learned from her that I realized I had to basically be a part of sharing this knowledge and information and education. And so I have done that since 2012, and it has brought me a lot of satisfaction, because I actually get to see people who are screened and treated and really see some changes happen in their life because of the fact that someone actually took the time to screen them for hearing loss, rather than assuming that they didn't understand or were having some issues with cognitive function. So I say all that to say why this is so important to me. So let's just jump right in. What we're going to talk about today is assessing hearing loss, communication styles for having sessions for a caregiver and a person with diabetes and their healthcare team. We're going to talk about the screening, the specific screening option, and then just why screening and treating, why those things are so necessary. So we'll talk a little bit about the pathophysiology, and then the impact of hearing loss on the person and how it impacts their diabetes, but then also how it can impact overall wellness. So whether it be quality of life, diabetes, distress, depression, etc. We'll also talk about what the rehab and the treatment options are, communication strategies for people who are experiencing hearing loss, how decisions can be made that are very specific to the person, which is so important. Also, how time and range impacts this. And the reason we talk about this is because what actually causes this issue is prolonged hyperglycemia. So if we can decrease the amount of time spent in hyperglycemia, we can actually decrease the risk of hearing loss at any level. So, what we know is that a person with diabetes is making roughly 180 decisions every day related to their health. They're thinking about, what am I eating for breakfast? Am I going to be able to exercise today? When is the next time I need to have a doctor visit so that I can have someone review my CGM results, etc.? Do I need to change my sensor site? Do I need to do something different about the way or my schedule, or how I approach my day, etc.? So it's a lot to think about. And we realize adding hearing to the list of things to think about can be overwhelming. But I think as we have this conversation today, you'll realize and recognize that it can actually make such a big impact, um, and is definitely well worth the time and the effort. So, what is the connection? Diabetes and hearing loss are directly connected. It is a challenging dual diagnosis because the hearing loss is twice as common in people with diabetes as in people who don't have diabetes. We know we have 37.3 million people right now in the US with diabetes. That's about 11% of the population. But we also know 48 million people, about 20% of our population, have hearing loss. So there is this direct correlation between the two. And even people who have pre-diabetes, their hearing loss that's a 30% higher rate. And then the other thing to keep in mind, so, we talked a little bit about in the beginning about how this is like prolonged hyperglycemia is what leads to the issue with hearing loss. And what I want you to remember is that anytime the hemoglobin A1C increases by a mean of 10%, the odds of the hearing impairment is increasing. So just for an example, to kind of understand what that means, if a person has an A1C of 7% and it increases to 7.7%, their impairment actually increases by 32%. So for every 10% increase, we are seeing a pretty drastic increase in risk of hearing impairment. What's also important to recognize and to realize is that a person with gestational diabetes, so these are people who have diabetes during pregnancy, they have high frequency hearing loss. That's sort of the connection. So it's specifically the high frequencies. And I'm going to show you what's called the Dawn's audiogram later on. And you'll be able to see kind of where that hearing loss falls as far as sounds. But remembering that those people, even with gestational diabetes, because they might potentially have times with that prolonged hyperglycemia, they are actually experiencing some potential for hearing loss as well. So it's something to think about. And it's really due to not only the hyperglycemia, but also the hormone fluctuations which cause hyperglycemia. What are some other potential risk factors? So it's not only having diabetes, because if someone is able to manage their diabetes through monitoring, with a CGM or self-monitoring, taking their medications as they're prescribed, healthy eating, active living, stress reduction, etc., those people are not having extended high blood sugars. But what a risk factor is to potentially having hearing loss is having that extended time when the blood sugar is high. Also, someone who is greater than 56 years of age, who has diabetes for a longer period of time. So there's a big difference between someone who maybe has had diabetes for 2 or 3 years versus someone who's had diabetes for 10, 15, or 20 years. Also, a higher BMI, and we'll talk more about this, but also comorbid conditions. So those people who have cardiovascular, hypothyroidism, etc. This is the anatomy of the ear. And the reason why I show this is because I want to draw your attention specifically to that thing that looks like a snail, which is called the cochlea. The cochlea is where the majority of the damage is taking place. And there's a couple things that's happening here. There is some damage to the nerves themselves, but then there is also damage to the blood vessels in the ear. And so when you think about all of the places where complications can occur in the body for people with diabetes, you always kind of go first to things like kidneys, the heart, nerves, getting to the tips of the fingers and tips of the toes, those kind of things. But if you also think about the eyes and the ears, these are places where we also have those very tiny blood vessels. So what's happening in the ear is that those blood vessels are actually breaking. So the analogy I like to tell people with diabetes so that they can understand what's happening in the bloodstream is that when the blood sugar is high, the blood is actually flowing through the body like syrup. Whereas when the blood sugar is in normal range, whatever is normal for that person, and usually that's in the range of somewhere between 70 and 180. But when the blood sugar is in that normal range, it moves through the body more like water. And so it can flow. But when you think about when it's high and it's moving through the body more like syrup, you could see how hard it would be to get to tiny vessels, whether it be in the eyes or in the ear, in the heart, in the kidney, places where there are tiny vessels, or how hard it might be to get to the tips of the fingers or tips of the toes. So that's what's important to remember. And specifically in the ear, what happens is the vessels actually, those tiny vessels in the ear actually start to break. And so it's partially nerve, it's partially those small blood vessels, but those are the things that are causing damage because of that high blood sugar. So things to remember is that this is progressive and there is some permanent hearing loss that can occur if there is a long period of time where it goes untreated. So like I mentioned before, it's damage to the cochlea, and then it's also that vasculature of the ear. The hearing loss that happens in the inner ear is where there is no cure for. So this is why making sure as people are diagnosed with diabetes, or even when we know that they have pre-diabetes, that those hearing screenings become regular so that even if there is any hearing loss right away, that can be treated. And then also cognition loss can be treated with rehabilitation, and we'll talk more about that. So the things to keep in mind is that as a person has some hearing loss, any level, they can have increased sensitivity to sound, they can have reduced clarity of words, reduced communication. So that can happen in both their employment environment, but also in their social environment with their family, their friends, sort of that entire social connection. It really does impair their social life. And then also it impairs their medical management. So as a healthcare provider, I have to be very sensitive to those who I have screened and are being treated for hearing loss, because the medical management approach has to be different to make sure that there is full understanding of the approaches they need to take in their self-care. I bring up this visual of the ear again, just to show that there are three sort of sections of the ear, and all of them are actually experiencing different levels of issues within the ear. But specifically in the inner ear, this is where the glucose, so the elevated blood sugars, have the most effect, is in that inner ear. It's the damaging of the blood vessels, the cochlea, the degeneration, etc. There are also other factors that affect that auditory system. So people who have excess noise, I told you I live in North Carolina, which is a big NASCAR state. And so those people who also are having exposure to, repeated days and days of high noise exposure. Also, people on specific medications, ototoxic medications, so antibiotics, diuretics, and these are very common medications. So it's having conversations about, the fact that if these are common medications after doing a screening with someone who has hearing loss, are these some things that we can change? And then also those other chronic diseases, so cardiovascular disease, kidney disease, and then any head trauma, broken bones, or anything like that, from diabetes related balance issues. So, something to think about is that when there are things going on in the ear, so it's the hearing loss, it's degeneration, issues with the cochlea, the breaking of the blood vessels, all of that is causing definite problems in the ear, but it actually then leads to balance issues because there is a connection there between hearing loss and balance loss. And so when we know we can screen and treat hearing, we know that then we can also really have an impact on the ability for the person with diabetes to be balanced and prevent falls. And then another direct association is kidney. And so when you think about the way that a person with diabetes is screened annually by their endocrinologist or a very diabetes specific visit that they have with their primary care provider, one of the things that happens every year is that they do have blood work to really show that their kidneys are functioning appropriately and at healthy levels. And so when there is a red flag with the kidney, there is a direct correlation because there are such similarities in the vasculature of the kidney that there is usually a direct connection to hearing loss. So what I like to tell people with diabetes is that if the provider, if your healthcare provider is telling you that there are some issues with kidney function, that is another reason for you to say, or if you're a healthcare provider, for you to know that a hearing screening is necessary. Like I mentioned before, there are other healthcare conditions that are also associated with hearing loss. That chronic renal disease, that's a big one, because remember, that's kidney function. But diabetes, hypothyroidism, MS, cardiovascular disease, and more. So just keeping in mind that it's not only diabetes, which makes screening for hearing loss even more important as part of care, for the overall health of the person with diabetes. And this is kind of just some of the things we talked about earlier. But if a person is having multiple sinus infections, if they have osteoarthritis, if they have severe bowel problems, dizziness, kidney disease, high blood pressure, these are all reasons to be thinking about making sure that there is a hearing screen. So, I told you that this story for me started in 2012. And in 2012, I, constantly was trying to brainstorm with the audiologist, Kathy, how do we get involved? Who do we have to have conversations with to make sure more people are aware of this association? And we talked to the Association of Diabetes Care and Education Specialists. We talked to the American Diabetes Association, audiology groups, and over time, collectively, we were able to say to the American Diabetes Association, who create the standards of medical care for healthcare providers to follow, to say we need to make sure screening for audiology is included. And so it was amazing because although it took 9 years, in 2021, when I opened up the standards of medical care, I saw the places where we need referrals for care management for people with diabetes, and eye care was always there, family planning was there, medical nutrition therapy, diabetes self-management education and support, dentist, mental health, social worker. But now all of a sudden in 2021, it said audiology if indicated. And that is vague, but it was the first time we actually got added to the standards of care. And that was a huge moment. And the good news is that although the first time was in 2021, it's been in the standards of medical care since then. So 2022, 23, 24, and I'm assuming will continue to be, especially with as much as we are trying to continue to do to spread the word about the fact that there is this connection. So when you're thinking about, okay, who is going to do a screening? What is the screening? How do I get it done and when? The things to remember is that when a person is diagnosed with diabetes, they should have a hearing screening. So if you meet someone and they say, I've never had a hearing screening, or if you have diabetes and you've never had a hearing screening, that's the when. Go and do it. Okay. Who, as far as the screenings go, a dietitian, a diabetes care and education specialist, a community health worker, anyone on the care team can help you do the screening, because the screening can actually be done. It's a questionnaire. It can be done with the person and the person's caregiver. And that can be through a medical assessment, through a class, you know, just any way that we can share this link. It's to the Audiology Project. It goes straight to Hear Screen USA, and that screening can be completed, and it will indicate if they need to be referred then to an audiologist for care. Some other observable symptoms to keep in mind is that if a person is saying, huh, or they repeatedly say what, or they say, I can hear you, but I can't understand you. These are cues that they probably are having some level of hearing loss, but they are trying very hard to keep up. They may cup their hand behind their ear. They may ask for an interpreter. But also you may notice that they seem confused, or that you've had conversations back and forth with the person who has some level of hearing loss, but when they come back to you to review some self-care management behaviors or something like that, they're not remembering those, or it's as if you actually didn't even have the conversation. So it wasn't that they didn't want to know and understand the conversations you were having with them. Maybe it was that they couldn't hear you. So it's a lot of misunderstanding, and then not able to follow through on the self-care. So when that happens, this has to be a time when we internally reflect as healthcare providers and say, is there something I could have done differently? And in that case, it may be to screen for hearing loss. Okay, so what are some of the effects of untreated hearing loss? You know, for me, this is why I have had these talks since 2012. It's because if a person goes for long periods of time with untreated hearing loss, they're losing that ability to process speech. And I'll talk a little bit more about that, but what that means is that the connection of hearing the sounds that a person is saying and what they're saying isn't getting to the brain to process and understand. So the person is also extremely exhausted. They're spending all day looking right at you so that they can see your lips moving. They can watch your body language so that they can get every possible cue so that they know what you're saying. A person who doesn't have hearing loss can be multitasking, going about their day, cooking, cleaning, listening, and doing everything totally different. But a person who has hearing loss has to spend a lot of energy on the focus of that. So that leads to tension. It's social anxiety. It's stressful. It's withdrawing from personal relationships. There's depression. Overall, this is impacting their psychological health. This is the reason why untreated hearing loss is unacceptable, for us as healthcare professionals to allow, but also why we encourage people with diabetes to be screened. So like I mentioned, that inability to hear does affect the brain. So there becomes this problem with understanding speech. And the thing that actually helps it the most is for it, the hearing itself needs to be treated. And so the number one treatment is hearing aids, okay? And so when a person has the hearing aids, they've been fitted for them so that they know that they're comfortable. They're at a volume that is comfortable. There's understanding of the use of the hearing aids. Once all of that is in line, the beauty is that now rehabilitation can start. And it's truly a rehabilitation of processing that speech. Okay. So it's working with a speech therapist, understanding, starting to really understand taking in a sentence, processing it, and then being able to fully understand it. So, what's really important for people to know if they are working with someone with hearing loss is it's actually not talking louder, it's talking slower. That's what allows the person with hearing loss to process everything that person is saying. So it's slowing down rather than getting louder. So, like I mentioned before, hearing devices, definitely hearing aids. Any assisted devices are also so helpful to this person, whether it's having subtitles, things like that, anything that can help them. Also, treatment could include the counseling, the rehabilitation counseling for processing speech, but then also counseling for depression or any mental health um, sort of roadblocks that they ran into while they had issues with hearing loss. And then anything that also can be immediately improved, like if there was some loss from use of steroids, that kind of thing. This is my favorite thing because as a clinician, one of the things that the audiologist may send back is where the hearing loss actually lies for the person with diabetes. So if you see here all the way at the top, this is basically normal hearing. These are people who could hear things like the birds chirping or leaves rustling, which this time of year you're going to hear a lot of in the fall. People whispering. So this is normal hearing. You see there, as those hearing level, the intensity, the decibels, as they go up, as they increase, this is where there is different levels of hearing loss. So mild, they may just have issues just hearing all the words people are saying when they're talking. Somebody who has moderate will have issues hearing all the things at the top of the page, but they're also now starting to even have issues hearing things like a baby crying or a person vacuuming. So as it gets lower and lower to severe hearing loss, profound hearing loss, it's getting to the point where even very loud sounds are hard to hear. And so that's why I like this audiogram, because it helps me to understand, what does mild hearing loss actually mean? What can't they hear? They can't hear the things from there up on the page. What does moderate mean? It just helps you with a visual. So some things to remember is that, what we really know is that we know that we don't want that prolonged hyperglycemia. When we prevent that, that's how we decrease risk of this and all complications. So we want to maximize the amount of time in range. We want to minimize time either in high blood sugar or low blood sugar. We don't want much glycemic variability. So we want to optimize the amount of time that a person is spending in that 70 to 180 blood sugar or better. And then another thing to think about, this isn't for everyone, but for people who are really trying to decrease that amount of time spent in hyperglycemia, in 2019, the Nutrition Consensus Report was released, and one of the things that really showed a high impact on glycemic management was low carbohydrate meal plans. And, it's thinking about those lower carbohydrate plans with high protein, but still some carbohydrates at each meal, to try to keep that blood sugar stable. So the improvement of time in range, because it helps to really help decrease that small blood vessel damage, and that's what decreases those rates of hearing loss. Also, we want to make sure that blood pressure is always in check. It should be checked every time we have an interaction with someone with diabetes, because that blood pressure has got to be managed just as clearly and effectively as the blood sugar. And when we talk about low carbohydrates, in that 26 to 45% of total calories, that's why you don't want to say that meals should have no carbohydrates. They actually should. There should be some level of carbohydrates at each meal, but always paired with a source of protein and always very consistent throughout the day. So we're not seeing those spikes and dips. And so, of course, the key things when we're thinking about nutrition is thinking about using the plate method, carbohydrate counting, really thinking about label reading, and what are the things that we can do to set up our environment for success as far as the foods that we bring into our home, because that's what's going to help the most. And then, of course, we know that this assessment is key. Making sure that we have this on hand in our offices. So the self-assessment for the person with diabetes, but also that assessment for those significant others. It can really help with the screening and help us to identify who needs to go from screening to care. And this just gives us a good initial assessment, then sending them to the audiologist for the next step. So some great resources are here in this deck. Just remembering that there are so many options across the country, online resources in your areas and in your communities, but making sure that having a relationship, healthcare providers having a relationship with an audiologist who's in their network, whether it be just that's in their county or in their community, or someone that can be accessed, maybe even if it's beyond. So in an area that has low access to care, how do we at least find a network for access to that audiologist? Also being aware that there are some really great apps for hearing impairment. Of course, that Hear Screen USA, that's where the screening can occur. Caption Fish, My Smart Hands, there's all kinds of different opportunities for apps for people who are hearing impaired so that they can have that additional assistance as well. So let's put it all together. Here's what we know. We know that we can screen and treat for hearing loss. So we need that improved hearing at the center with the person with diabetes. We know it will lead to better family relationships and communication. We know that this will give them more energy and provide them with less fatigue, less isolation and depression. It improves their quality of life, and it will improve their opportunities as an employee. So just remembering that the person with diabetes, they may be taking specific medications that impact their hearing. There may be some pathophysiology that's impacting their hearing. But when there is hearing loss, it's leading to consequences. So we need to make sure that they have access to diabetes self-management and care and support. We need to make sure that there is access to these screenings. And then we need to make sure that they can then be referred to audiology. That's why we need that network. And overall, all of this together will help to improve outcomes. So as far as practical applications, where do we go from here? The key things are making sure that a person with diabetes is aware if they haven't been screened for hearing loss, they should be. Hear Screen USA is one they can do on their own at home. For healthcare providers, remembering that if they have someone that's newly diagnosed, that's a trigger. If they're seeing that there are issues with kidney function, that's a sign. Anything that seems like it could be a cognitive impairment, that's a sign. So remembering that there are all of these reasons why we would want to consider um, screening for hearing loss, and we as healthcare professionals we owe it to the person we're serving because they deserve to know that this could be a potential opportunity for them also in their self-care. So I want to thank you all for allowing me to come and talk. I am like beyond honored to be able to speak with the Diabetes Sisters group. My email is there because I would love for you to ask me questions if they come up. The door is always open for that. So I'll pause here and just see if we have any questions.
Yeah, thank you so much, Joanne, for educating us today. I had no idea, as someone living with diabetes myself, that I needed to be screened for hearing loss. So thanks for that.
Mhm.
And we do have a few questions.
Okay.
Please continue to submit questions in the Q&A. We'll get to as many of them as we can. Our first question is, what is an example of someone who had hearing issues, was screened, and then saw improvement? Can you explain a little more so that I'll know how to talk to my doctor about this?
Okay, great question. It's interesting because one example I have, and this was, kind of early on, right after I was working, kind of with some patient groups in North Carolina, we started to implement this hearing screening. It was something we had never done in the past. And we had a family that actually came in. We had done the screening with an older woman, and we sent her on to audiology. She had she had started through all of the care. She had gotten the hearing aid. She'd gotten fitted. She did have issues because she thought what she as she was hearing, like, it was too loud, so it was really uncomfortable for her, but she was able to get that sort of correctly set because it's specific settings that were needed on the hearing aid. So she was able to get that set, and then she was so much more comfortable. But it was when the family came back with her for a follow-up, what they told us was that it was like watching a flower that was wilted, straighten back up and then open up, because they said for a long time, and the furthest back they could remember was they thought it was about for 2 years, she was slowly pulling away from doing things like going to church events, going to family functions, and to the point where she was sort of like the bent over flower. And what they said was that it was like they slowly, as they saw that she was becoming more comfortable, her hearing was improving, she just started to get back involved in all the things that she loved. And it wasn't only that social reconnect that they saw, but then we, as clinicians and her diabetes care team, saw a complete improvement in her blood sugar, because all of this was actually leading to less stress, less social anxiety, and just more joy overall. And so she saw improvements socially, but we also got to see the improvements in her outcomes and her overall health. So to us, this was, just such a blessing that this was something we could then start to incorporate, not only for just this one person, but for all of the people that we were serving.
That's amazing. Second question, if you have, excuse me, if you have diabetes, is audiology screening covered by insurance?
Yeah, and audiology screening, so if you're referred because of an assessment that leads to the final score of a referral to audiology, an audiologist visit is covered. I mean, everybody's insurance is going to be different. So no matter what, it's going to have to be, seeing if there's copay, if there's deductible that has to be met, et cetera. But it is, under most insurance companies, a covered visit.
Okay. Next question from Deborah. Do you know if tinnitus is caused by diabetes, or do you have any help in getting rid of it?
Okay, that's a good question. So it is directly related to also that elevated blood sugar, the tinnitus. So it is sort of all of the things we just talked about are things that you would also want to be thinking about. Are there ways that you can keep your blood sugar stable, preventing spikes? But that is definitely a reason to also see the audiologist, is for that tinnitus.
Okay. And let's see, Anonymous asked, does exposure to loud noises increase my risk for hearing loss? My management is good, but I've had diabetes for a long time, and my watch alerts me when I'm in a loud environment. Should that be a concern?
Yeah, I love that. I have the Apple Watch too, and it tells me also, and honestly, the answer is yes, you should be careful in being in those loud environments for too long. So if it's short periods of time and you can sort of wrap it up and remove yourself from those loud environments, you should. Hearing that you're managing your blood sugar is a positive thing. But remember that there are other components. So it's the duration of diabetes, the noise exposure, um, age over 56. So just remember that if you have kind of more of those factors, even if your blood sugar is managed, it could be a reason to at least be screened.
Okay. Are hearing side effects monitored during clinical trials for new drugs?
Good question. I mean, for the ones that we mentioned, the ototoxic medications, it should be. That doesn't mean that it is, but that would, of course, be a fun thing for us to advocate to the FDA for, because it would mean that they would have to include that in clinical trials. So I hadn't thought about that before, but now you have me thinking that maybe we need some letters to the FDA about that.
Absolutely. If you have several of the diseases that increase risk for hearing loss, does it increase your overall risk?
It does. So it's all the more reason to be screened, and that's the reason for these conversations, is because we talk specifically about diabetes, but I shared with you the other co-conditions where the risks are increased. So if there are multiple co-conditions, being even more proactive about making sure you're being screened, you're having these conversations, you're looking for an audiologist in your area, those kind of things. Definitely.
Okay. All right, that's all the questions I see. Thank you again, Joanne, for sharing such valuable information with us today. I'd also like to thank all of you for joining us and engaging in this important conversation. If you have any further questions or would like additional resources, please don't hesitate to reach out. Thanks again for being here, and we look forward to seeing you at our next event.